weeks, this group has been working together and with many of our public health stakeholders on the situation we face with the Ebola virus. 3 countries in Western Africa, Sierra Leone, Guinea, and Liberia, are facing an unprecedented situation with Ebola. Public health officials believe that 9,000 people in those countries may have contracted Ebola, and there have been approximately 4,500 deaths. The federal government recognizes that and has worked hard to help address the problems in these countries. That's where the epidemic is the most acute, and that's where World Health officials can do a lot of good. I know that all of our prayers and thoughts are with each victim of Ebola and with their families, and I want to particularly thank the people in this country and throughout the world who have helped to reduce the suffering from this epidemic. Let me be clear that Delaware has no Ebola case. While the risk of transmission in Delaware is low, the Division of Public Health is working to ensure that the appropriate screening tools and disease prevention strategies are used to further reduce any chance of transmission. Effective Monday, October 27th, the Division of Public Health began daily monitoring of all travelers from the 3 affected West African countries, whether or not those people report contact with known or suspected Ebola patients. Additional action steps have been put in place over the past several weeks based on any contact that individuals in Delaware may have had with Ebola patients, and Dr. Rattay will discuss in a couple of minutes the specifics of the protocols that we are following based on the recommendations of our public health experts. Ebola is a very difficult disease to transmit and can only be spread when somebody has symptoms. The likelihood of getting the disease from normal, everyday contact with a person sick with the virus is extremely low. However, prevention and preparation are vital government responsibilities, and the state of Delaware began to get ready for the potential of an Ebola case or cases weeks ago. The work began with the Division of Public Health and the Department of Health and Social Services. Public Health is an emergency medical services and emergency preparedness group whose responsibility is to actively respond to any potential health threat. And this group is working closely with hospitals, with medical providers, with EMS companies, and many other partners to prepare, to coordinate care, and to provide advice and guidance. And the issues being addressed by this group are how to screen for the disease, safe ambulance transportation of potential Ebola patients, personal protective equipment guidance and availability, hospital readiness, infectious disease monitoring, and protocols for any doctor's office that might see a case. You're going to hear more about these efforts from Secretary Landgraf and from Dr. Rattay in a couple of minutes. But our response is not focused on just one agency. Earlier this month, I directed my entire cabinet to work together to prevent any spread of Ebola and to help address any cases should they manifest. And I want to thank Mike Farlow, who's my chief of staff, who's sitting out in the third row on this side, for working very, very hard with the cabinet on this issue. The cabinet's responded, and efforts have involved many different agencies. So, for example, the Department of Education has shared public health information with thousands of Delaware parents and is working closely with the Department of Health and Social Services to help prepare schools to respond. The Department of Natural Resources and Environmental Control is working on hazardous waste concerns. The Department of Transportation is working on the transportation of related waste and partnering with DHSS to ensure public transportation workers are updated and informed about Ebola prevention. The Department of Safety and Homeland Security, including the Emergency Management Agency, is prepared to provide security should the need arise, to mobilize the law enforcement community, and to provide leadership on emergency response. We can't and we don't take Ebola lightly, and I want to thank and commend the hospitals, the medical providers, EMS, law enforcement, and fire companies for their partnership and preparation. So now what I'd like to do is turn it over to Secretary Landgraf, whose agency is leading the preparations, and then you will hear from the Dr.
We
Rattay.
understand that people are indeed concerned about Ebola. I know they are worried that someone could be diagnosed in Delaware, but we also want them to understand the facts. 4 people have been diagnosed with Ebola in the United States. 3 were associated with 1 hospital in Dallas, Texas. 3 are actually healthcare workers, 2 of which have already been discharged. Unfortunately, one person, Thomas Eric Duncan, has actually passed away. None of the personnel or community contacts, none of the personal or community contacts of Mr. Duncan have gotten ill. For more than a month since Mr. Duncan was confirmed to have Ebola, we have worked to coordinate our collective response should someone present at a healthcare facility in Delaware with a travel history to West Africa and with symptoms for Ebola. Primarily through the Division of Public Health under Dr. Carol Rattay's leadership, we have worked with our partners in the healthcare system, with Delaware first responders, with DEMA and other state agencies, with the governor's office and with the CDC to prepare for any possibility. Our 9 hospitals, EMS, walk-in clinics, primary care practices, and other medical providers have all gotten communications from Dr. Rattay and her team to screen for patients who present with symptoms of Ebola, which are increased fever, headache, diarrhea, vomiting, stomach pain, unexplained bleeding, and body aches. Most importantly, they have gotten guidance to screen those patients for exposure to someone with Ebola and to take a recent travel history if needed. In our shared responsibility, our 9 hospitals have been strong and consistent partners. They all have confirmed the ability to manage a patient with Ebola. That means they have put into place plans to isolate the patient, and they are training their healthcare workers in the use of personal protective gear, also referred to as PPE, and also training in practices in order to keep them safe. If the case is confirmed in Delaware, a CDC rapid response team would be on the ground to assist us. They would support the Division of Public Health to trace any potential contacts who might need to be quarantined or isolated if indeed ill. The CDC also would work with the state and the hospital to determine if that ill patient should be moved out of state for additional treatment. As I stated earlier, 3 of the 4 people diagnosed in our country have indeed been those healthcare workers. They risk their lives to offer care and compassion for individuals with Ebola. Healthcare workers deserve our gratitude for what they are doing to end this crisis and for what they do every day. The healthcare workers who have contacted Ebola illustrate the greatest risk. The 2 nurses in Dallas and the doctor hospitalized in New York all had direct contact with blood or bodily fluids of individuals who were severely ill with Ebola. That is an experience that the vast majority of us will never have. Because of the diagnosis of individuals in the United States and the intense media coverage, we know that Delawareans have questions about their level of risk and what should they do if they suspect a person they encounter may be infected with the Ebola virus. First, the Ebola virus is only transmitted by patients who have symptoms. The risk of getting the disease through normal, everyday contact is very low. Second, we shouldn't be afraid of individuals who immigrated here from West Africa or who have visited family or friends there in the past several months. Discrimination has no place anywhere. If you do wish to discuss a suspected case, please call our Division of Public Health at 888-295-5156. Again, 888-295-5156. 295-5156 during business hours, or area code 302-744-4700 after hours, on weekends or during holidays. Finally, I want to extend my appreciation to Dr. Rattay and her entire team of the Division of Public Health for their commitment and dedication to protecting the public's health. With our healthcare and emergency response partners from across the state, we are continuing to prepare for the worst while we continue to hope for the best. No planning goes wasted. It is something that we do on a continuous basis for emergency preparation. Now, it is my honor and pleasure to introduce Dr. Carol Rattay, the state's Director of the Division of Public Health.
As has been mentioned, one good thing is that we know this disease is extremely hard to transmit. It can only be transmitted by someone who has symptoms. And so one thing we'd like for people to keep in mind as you move throughout your day, especially at this time of year, when many different viruses are out there, such as influenza and a variety of other kinds of viruses, all of these viruses can be killed by hand washing or the use of alcohol-based hand sanitizers. So that's always going to be one of the best modes of prevention. DPH recently implemented a new monitoring program in coordination with the Centers for Disease Control and Prevention. So for anyone who's returning from one of the 3 countries of concern, Sierra Leone, Guinea, or Liberia, through this monitoring program, we are tracking and interacting with anyone who has traveled from one of those countries and is now in Delaware. The individuals are monitored for the full duration of a potential 21-day incubation period. People who have traveled from one of the 3 countries are placed into one of the 3 categories. This would be high risk, some risk, or low risk. And these individuals in any of these categories will talk with or meet with DPH epidemiological staff daily to assess for fever or any other symptoms. So high-risk individuals are those who have had direct contact with Ebola patients, and that would include persons who've been exposed to the blood or body fluids of a person with Ebola who had symptoms. And that would be an exposure such as a needle stick exposure while caring for someone who's symptomatic with Ebola, or it could be a close family member who's providing care and was exposed to a person infected with Ebola without being protected with personal equipment. So those would be the individuals that fit into the high-risk category, a very, very rare category indeed. The next category is some risk. The some risk category includes healthcare workers who have had direct patient contact, hands-on contact with a person who is symptomatic with Ebola virus and who has appropriately used personal protective equipment or PPE at all times. And a low-risk individual is an individual who has no known direct contact with persons infected with the Ebola virus. And this by far is the largest category. The CDC has estimated that approximately 95% of individuals that are coming into our country fit into that low-risk category. Here in Delaware, since the monitoring program began, and we began getting information a couple of weeks ago, we now have 11 low-risk individuals who are being monitored daily in Delaware. 8 are in Newcastle County and 3 are in Kent County. They've all been provided a fever monitoring kit They've been instructed on how to take their temperature twice daily and are being contacted every day by the Division of Public Health. If any of these individuals develops a fever or symptoms, they will contact public health and we will help get them to the closest hospital for evaluation and, if needed, isolation and testing. Individuals considered at high risk and some risk categories will receive what we call direct active monitoring for the 21-day potential incubation period. This direct active monitoring will take place by Division of Public Health staff, and it includes daily visits. High-risk individuals, which again, as I mentioned, is a very, very rare category, but individuals in that category must be quarantined at home. The some risk category individuals will be asked to sign an agreement with us that involves limiting their activities, including avoiding public transportation and large gatherings, and seeking approval from DPH to travel. We believe our approach is based on the best available science and also protects the public. I want to thank you all for joining us today.